And here with answers to your medical questions in our Ask the Doc segment is Dr. Msonthi Levine. And we hear so much about those kids that are competitive and their coaches saying if you can't spend the time and the hours, then you're not going to be on the team, and the parents pushing them. What do you do in that situation?
I mean, I would do exactly what this segment indicated. You have to let your body heal. Unfortunately, we're in a very competitive society. I think everyone's always looking for that big athlete to make it big and make a lot of money, etc. But
take care of mom and dad when you get older.
Absolutely, but they have so much time to do that.
Right.
So I certainly would rest in between seasons. You know, there's a big following here, select baseball. The kids are playing baseball year round. You know, when I played Little League here for South Park, we had a huge break for our bodies to heal, and we didn't really have as many injuries as they do now. So I certainly agree with that. There's a lot of time for the kids to get older, work on their techniques, get their strength, get their stamina. There's no reason to rush right now. They're not going to get it all done when they're young. I was an athlete. You know, we took a lot of time off, so there was a lot of time to showcase your performance in the future. So I certainly would rest.
Take the time.
Absolutely.
All right, on to some of our viewers' medical questions.
Yes,
what does it mean if your TSH is low, but your T3 and T4 are normal?
It's a thyroid test, and sometimes when we check thyroid, sometimes it can be a little low normal, as we say. Certainly, I would probably check it in 30 days, 2 months or so, just to see if it's higher or lower. Anytime we check any blood test for that, say kidney function, thyroid, cholesterol, it could be a little bit low, a little bit high. Just kind of depends on the situation. So I'd probably repeat that lab in a month or so.
This person says, I had 2 C-sections, and when I'm on my cycle, it hurts where I got cut, and when I sneeze, it's very, very painful. What's wrong with me?
I probably would suspect some good old-fashioned scar tissue.
Lovely.
I know a lot of times that's a big scar with C-section. Everyone heals differently, and just depending on your post-operative course, you may have had more complications, and inflammatory medicines work really well, but I wouldn't be too concerned about that.
Okay, another one. How safe are blood transfusions,
really? They're very safe. You know, years ago they were a little unsafe, but the technology now has gotten them pretty safe. There's a lot of things that they check the blood system before they will allow the blood to be donated. So I would take it. We give blood all the time in the hospital for all sorts of conditions, including anemia, so I think it's very safe.
Okay. I have these moments where my head is it freezes inside. It's like everything shuts down and I'm conscious, but I can't move, and it feels like something is squeezing my inside. Then afterward, I can't breathe and I just start shaking. Do you know what could be the cause of it?
Some things that I would certainly think about are migraine, a complicated migraine for one. Sometimes seizures, you don't have to be on the ground foaming, unconscious. Seizures can be very subtle. So those are some of the things I would think about. Sometimes allergies can cause that tight feeling, especially during the yellow dust season. Maybe try an antihistamine, but certainly don't let these symptoms go unabated. Certainly get to your physician for a full evaluation.
Okay. If a gene that triggers autism can be found, can it be altered, or can medication theoretically be made to cure it?
I mean, I think that's the whole idea behind finding out the human genome, is to get to the root cause of a lot of these illnesses so that we can maybe come up with some medications or alter. That's a long, long way off, but that's certainly the idea with any illness, that we try to find the gene that causes it.
All right, and we've got lots of other questions. We'll get to those in just a minute, so don't go away. Dr. Levine will answer more of your questions next on Live at 5. We're back with Dr. Msonthi Levine to answer more of your medical questions. This viewer asked, in the past few weeks, I've had a burning sensation that's developed in my left ankle. What could it be?
I probably would think of arthritis of the ankle. You know, we talk about osteoarthritis a lot, or degenerative joint disease, the back, the neck. So I'd probably think of arthritis, probably try anti-inflammatory. Also think of that good old neuropathy that we hear about all the time. Yes, ma'am. So.
Okay, another question. What are your thoughts on e-cigarettes? Are they safe and do they work?
I think they're fairly safe. I think the more dangerous thing is to continue to smoke. So I think anything you can try to stop smoking, try to use it. It may require several years to stop smoking. It is one of the hardest things to do. So try to use everything available to you. It could be e-cigarettes, the patch, the gum. Just keep trying, because it is so detrimental to your health. I've been practicing medicine for 14 years. Smokers do so much worse than those who do not smoke, so try everything.
Okay. An 11-year-old with no growth in 2 years, 68 pounds, 4'6". Is that normal and healthy?
You know, I don't know. I don't do a lot of that in my practice. Certainly the pediatrician, they normally follow that, and if they see a patient going off the pattern, they normally do an evaluation, make sure the thyroid and basic things are going okay, make sure they're eating good food, and certainly if they find something, getting them to the right subspecialist.
Okay. What causes people to grind their teeth?
A lot of times it's anxiety, depression, nervousness. You know, we live in a very stressful society. There's a lot of things going on, bills, job, marriages. A lot of times it's just a lot of things going on, and that's one thing that we do is grind our teeth. Certainly you can wear a mouth guard to help. Certainly get an evaluation, make sure your thyroid's okay. Sometimes medications can do that as well.
I like how you lump marriage in there as well. It's
Absolutely.
one of those stressful things.
That's right.
This person asked, is there anything sold over the counter to treat anxiety and or panic attacks?
As far as I know, no. You know, there are a lot of herbs and things out there on the market that can be used for a lot of things. I just say buyer beware. Look into that, investigate it. The average physician like myself, we really don't know all the ins and outs of herbs and supplements over the counter. It's not a very regulated industry, so just beware. So I might try that, but as far as I know, no. Some people use Benadryl at night to help them sleep when they're anxious or depressed. I think if you don't have any medical problems, that'd be okay to try. But if you're older, you know, a lot of medications, I certainly would not try that.
But don't mix it with your prescription medicine.
Don't mix it with that. Don't mix it with alcohol. Alcohol can certainly make things worse, including Tylenol. A lot of people use Tylenol PM for aches and pains to help them sleep, and they combine that with a little beer, a little alcohol, so dangerous combination.
Okay, another question. A 21-year-old girl has vertical black line down her middle finger. What could it be?
It could be nothing, and we've talked about this a lot. A lot of chronic medical problems cause changes in the nail, and sometimes we use it as a clue. But a lot of times the disease that's causing it is very obvious at the time, and oh yeah, by the way, look at your nails, how they're changing. So I certainly would just do a basic evaluation, see if anything is happening. But if nothing pops up, I really wouldn't be too concerned. Sometimes melanoma can do that, so if it was a young person who had a lot of sun exposure, I might be concerned about that.
Okay. Is multiple sclerosis an autoimmune disease?
That is the current thinking. We don't know the exact cause in terms of why it starts, but that is the thinking. We use immunosuppressants, a whole array of immunosuppressants to help treat that disease. The problem with MS is it can be an elusive diagnosis. Even amongst specialists, they can disagree with that.
All right, Dr. Levine, as always, we appreciate you taking
Yes,
the time
ma'am.
to stop by and answer our questions. And you can always visit our website and see the answers to these and other medical questions posted online. And if you'd like to have Dr. Levine answer your medical question, you can always mail us at the address listed on your screen, fax us 892-7305, email us at laf@kftm.com, or you can post those questions every Monday on our KFTM News Facebook page. And coming up next on Live at 5, Greg Bostwick takes a look at your work week forecast.